Welcome back to MidPoint. The Chief Medical Officer for Tenet, Florida Physician Services, Dr. Edward Anim-Addo, is here in our studios today. You were talking about the CDC when we left, but I have to ask you this. Do you trust the CDC?
Yes, absolutely. I do trust the CDC. I think the CDC has capabilities that that are non-parallel anywhere in the world, and indeed the expertise that we have represented in the CDC is what's helped us be able to take care of previous epidemics with Ebola and other hemorrhagic fevers around the world. Indeed, Tom Frieden at the CDC had commented recently about the Nigeria portion of this epidemic, which apparently seems to at least have ground, not to some halt, but at least appears to have been controlled compared to some of these other areas where we did not have appropriate infrastructure in the sub-region, West Africa. Now, Nigeria does have some infrastructure. We received a lot of CDC help and was able to, at least at this point, it appears to have at least slowed the transmission of the virus within a large metropolis like Lagos, which is over 10 to 20 million people, about the size of Liberia and Guinea and Sierra Leone combined. And yet the number of cases reported to date is less than 20.
Fair to say, though, that the administration, the CDC, and someone at the hospital in Dallas, they've badly handled this, and they've made huge mistakes along the way.
Well, absolutely fair to say that, because clearly, and I would hesitate to be critical of the hospital until we have all the facts as to what happened and what process failures occurred that led to this. However, it is fair to say that with a heightened public awareness and even children, quote, talking about Ebola, it seems rather unusual that someone with a history, as was provided to the hospital, would be allowed to actually go back in the community. What is encouraging, though, about this is that as soon as the case became evident, what has happened is that we've had all of the apparel of our public health system get in place. We've had quarantine, we've had contact tracing, we've had surveillance, and at this point I understand that we've also been able to identify that one individual who had contact but could not be located. And that's extremely encouraging.
What is your thought process on putting CDC members, really well-trained people who can understand and see the virus, at airports, at ports of entry to the United States, and screening everyone?
Well, I would refer you to the WHO directive, which is a public health emergency of international concern. As signatories to that, 196 nations around the world, these are international health regulations. This should have actually triggered some of the activity that we are now seeing, and I think this is in response to that and is entirely appropriate.
So it was late?
I do not, I wouldn't say that it was late. I would say that given the scope of our challenges with it here and now, it is appropriate to institute the measures now. But earlier it would have been a little premature.
Would you say, though, with the scope of those challenges, as you put it, though, that someone needs to be at the airports in this point of entry, not just an emergency room physician, but someone CDC trained, WHO trained, who can understand, see it, identify the possibility of it, and be able to better give a quote-unquote diagnosis at the point and stop it there?
Well, yes, and this requires cooperation, actually, on all member nations around the world in relation to this global emergency, as it were. What we must understand, though, is we've got to put this in context again. We have no more than 5 cases in the U.S., 3 of which we actually imported in so we could treat, and 1 of which we know about in Dallas, and 1 who's the NBC physician, the NBC technician, who's actually headed over to Nebraska. And there are 9,000 or so cases reported to date with a very high case fatality rate. But what we need to do is what actually the administration, I believe, has finally done, which is send a response in to help build systems over in Liberia and in Guinea and in Sierra Leone.
I have about 30 seconds left, unfortunately, but let's talk about cures, treatments. ZMapp is out there and all the others. Is this a drug, and are there drugs out there, to your best knowledge, that can tamp this down, that can get this under control, and maybe even cure this one day?
Well, unfortunately, I think there are no drugs currently that have gone through the rigorous processes that we expect these agents to go through. Compassionate use was what was evoked to provide ZMAP to these individuals, some of whom actually did well, and one of whom actually did not do well.
But we're a ways away.
Yes, we're very ways away from that. I think the focus, as we saw from Anthony Fauci the other day, was on vaccine preparation and vaccine development, and vaccines directed at the glycoprotein envelope of the filovirus, in this case Ebola, are probably the more faster approach to trying to help control this epidemic.
We are unfortunately all out of time. Please come back again and help us, because at least give us some fact and some calming here, so that at least we know what's going on. Dr.
It was a
Addo,
pleasure.
thank you very much for being here today.
Thanks for having me.
Later on this hour, let's dig into the Supreme Court and what they might wager on this season. That and a whole lot more coming up right here on MidPoint.